I'm just a passerby, passing by all the people sitting on their rooftops in the midday sun. And I know everything.
Parkinson's disease is a brain disorder discovered in 1817 by James Parkinson, a British physician, for whom it's named. If all of these people driving by were over 65, only one would have Parkinson's. 5 to 10% of all cases occur in patients under 50. It affects men and women equally.
Dopamine is an organic chemical produced by the body that allows muscles to perform smooth and coordinated movements. Without this chemical, muscles act in abrupt, jerky motions. Cells located in the substantia nigra of the brain produce dopamine. In patients with Parkinson's, these cells have died or become impaired. Research about hereditary causes of this disease have discovered that Parkinson's sometimes occurs within families, but is not typical. Only 1% of all cases of Parkinson's are obviously family-related. Some environmental toxins are known to cause disorders similar to Parkinson's, but most Parkinson's patients have also been exposed to the same substances. Among these are manganese, carbon monoxide, and some pesticides.
Most Parkinson's symptoms become evident only after about 80% of the cells that produce dopamine are no longer effective. The symptom most often associated with this disease is the tremors, or little shaking movements. Other signs of Parkinson's include a shuffling gait and cramped handwriting. Patients may also have difficulty with balance. Generally, diagnosis comes by ruling out other diseases based on MRIs. Since this disease doesn't show on X-rays or through blood tests, the National Parkinson's Foundation suggests seeing a Parkinson's specialist. The most common type of medication is called levodopa, which is changed into dopamine by brain enzymes. This medication is absorbed into the gastrointestinal tract and then taken to the brain to be converted and then released. Levodopa helps the tremors and stiffness that come with this disease. There are also other forms of medication, but levodopa is the most widely used. Surgery is also a potential treatment option. Deep brain stimulation suppresses symptoms by placing a metal electrode in the brain that is regulated by a pulse generator. This fixes irregular brain activity caused by the lack of dopamine. Most medications and surgeries used on patients are to alleviate the symptoms of the disease, rather than to stop its progress.
Parkinson's is a hard disease to live with, no matter the severity of the condition. Extensive research is being done to learn more about the disease's cause and progression. Already, 4 genes have been linked to Parkinson's, and more information has been gathered about environmental causes. Advancement in research techniques has allowed researchers to gain knowledge from living patients as opposed to only being able to do research on human bodies when working with a corpse. Through advancing research, there is hope for Parkinson's patients not only to live more comfortably with the disease, but for prevention and a cure.
On a dark wet night in April, on a street in Jersey where I went looking for some writing that I knew would not be there. And a pointer from the bedlams and the police in the rain were concerned more